This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson, and it's my pleasure to have with us tonight Dr. Eddie Young. Welcome, Eddie. Nice to have you with us tonight.
Thank you so much for having me, Sam.
Now, Eddie, you're a man of many parts and many responsibilities. One of them is you're the president of the Bibb County Medical Society. Is that correct?
That is correct.
And you're the representative, in a way, for those doctors, and you kind of monitor the way the world goes as the doctor's representative. Is that a fair statement?
It's a representative not only here, but through the Medical Association of Georgia, looking how medicine is being, impacted at the statewide level as well.
Yes. Well, so, I think both of us are watching the way the world goes with as healthcare undergoes changes. There are lots of things that are in the wind, lots of things that are about to happen. And I think tonight we're going to have a discussion about some of the new regulations that appear to be coming from Washington in regards to physician responsibilities to patient care, and maybe the way that the government is misconstruing its power in that regard. And I think both of us saw in the New York Times a new plan that's out there. Maybe you could speak about it a little bit.
Well, when you say watching, I think we're watching with furrowed brow and great consternation.
Yes.
In late September, there was an article in the New York Times reflecting that the Obama administration is put out a process of which they hope to gather information from patients about what patients interpret as far as mistakes made by physicians or their other healthcare workers. And that needs to be important. It does just say healthcare workers.
I think that includes nurses, pharmacists,
hospitals as a whole.
Any way that a patient or their families believe that there's something amiss in the American healthcare system.
And more importantly, they've given a pretty specific list that delineates kind of prompting the patients as to things that they might have been injured by or be offended by. And it's creating an environment in which patients can apparently feel free to report their physicians or their care to the federal government in a direct manner, which is kind of outside of the tort system that we have involved right now, and our own. We already have a check and balance, which is the peer review system.
Well, so, I think physicians would say whatever we can do to make the American healthcare system work better. I think we're in favor of that. If there's in a way of allowing patients to make comments about anything that's amiss, no one opposes that. But it's just the methodology the government is employing and some of the negative impacts that it might have on the practice of medicine in the country. And this is kind of a pretty capricious, arbitrary gesture on the part of the government. If you look into some of the details with it, one of the things that disturbs me a little bit in it is the system that's about to occur in our country is that we have if I can ask our viewers to remember if they've had economics in the past, maybe they remember these little graphs that were put there. There's a supply and a demand curve. And so what's happened is the government is going to shift the demand curve up, meaning that the healthcare system is going to have lots and lots of people that are going to, you could say, flood into it a bit. There's also a tremendous...
You're talking about people as patients.
That's right. So when we have the demand for healthcare is going to really rocket up very substantially. And at the same time, we have these demographic changes that are in the hopper. Our population is aging. There are lots and lots of patients. More patients are coming. So we have this, at least I have the concern, that there are not going to be enough physicians there to handle this load that's coming at us. And at the same time, what the government is doing is they're making it a lot more difficult to practice as a physician, or at least they're sort of threatening physicians in a way. And what should happen, it should be, from classic economics, there should be either an increase in healthcare expenses. If you can remember those lines, the supply is being held static. There's no increase in the numbers of physicians. Demand is going up. So it should cause costs to increase. And if the government does not allow that to happen, or in some ways really beats up the docs in an unfair way, then that would drop the number of doctors even more. And if the government doesn't put more money into the system, what it inevitably causes are shortages and a decrease in quality. So this is a perfect storm that's being fostered in many ways. It's not as if the government is attempting to encourage physicians to be on the same team as I don't know, the winning side, if you could say it that way. They're treating them as potential enemies and culprits that need nips. And so that's one of the concerns I have. I mean, can you?
Well,
I spoke a long time. You want to make any comments?
Well, I think your point is very well taken, that there's going to be an anticipated shortage of physicians coming up. Remembering also that the physicians are underwriting their education. I mean,
yes.
Nobody's paying for their education. It's quite expensive.
Yes.
And the time lost for other incomes adds up. So with that, and if you make this more onerous and also
yes.
make the practice of it, I think there is going to be a shortage. The question is why? Why?
Yes.
Why? What is their purpose in designing a system that want to measure outside of our known and existing systems? Now, there's a lot of people out there throwing out suppositions that our hospitals are very unsafe places. People are dying willy-nilly all
yes,
over the place.
Yes, yes.
There was an article in the Wall Street Journal 2 weeks ago. Your hospitals are killing you.
Yes.
And I mean, this idea, I'm sorry, but I haven't seen this, in our practice.
Yes,
Maybe we
yes,
practice in an
yes,
exceptional
yes,
hospital.
yes.
And I don't see the truth motivation for improving patient care. It seems to be a little more nebulous desire that they're trying to achieve, such as save money.
Yes.
I think there's something else going on here. I think most of what is coming out of Washington ultimately has to be is how to write a smaller check.
Yes.
Whether it's to the hospitals, because this is going to impact the
Yes,
hospitals,
yes.
and or the physicians and other healthcare
Yes,
providers.
yes. Now, from your knowledge of physicians in Middle Georgia, would you say they're enthusiastic about the changes that are coming their way in the healthcare system?
The changes that are being forced on them right now, which include electronic medical records and adapting and getting prepared for accountable care organizations
Yes,
and those things.
yes.
No, I don't think they're totally enthused about it, and I don't think we've seen any true documentation that supports that this is improving care.
Yes.
And so in science, physicians are by definition trained in basic science.
Yes.
And we haven't seen the proof of this.
Right. So it's a little bit complicated. Just to keep talking about some of the new government regulations that seem to be in the offing. There's not any kind of law that mandates this. This is just being, I guess, instituted by bureaucrats. They're going to put these hotlines in. There's no necessary. There's no legislation that says this is what's going to happen.
No oversight.
The government is just basically doing it, and it's a little bit, to me, it's a little bit frightening. If the government receives, you could imagine situations where, I don't know, 500,000 complaints appear, whatever the number is, into some kind of hotline, and were the government to be dishonest, if one could say that, they would, or politicized, they could look at those complaints and they could say, well, who was a donor to a respective political party, and we'll just investigate those people. So it's a troublesome kind of thing that's being instituted without appropriate, to me, oversight, interchange, conversation about it, and putting a system in place where patients are respected and they're looked after, and if something goes wrong, they can certainly offer complaints. That all sounds okay to me. But the way the government is doing this, it's a note of concern.
Well, there's a key component here. Physicians are, by definition, advocates. We are advocates for our patients, and our primary concern and why we went into this is because we want to take care of patients.
Yes.
And this is a overt process of usurping our role as advocates and placing it in the hands of the federal government.
Yes.
The question for the patients is ultimately going to be, do they want the federal government to be their advocates, or do they want their physicians to be their advocates?
Yes, that's a good point. Another one to make, I think, on this particular issue, Eddie, is This is a very kind of shotgun approach to doctor-patient relationships. So if in fact the patient is not thinks a mistake has been made with anybody, I mean the pharmacist did something, the nurse did something, whatever it was there, they can lodge a complaint with the federal government. Additionally, if the medical provider, the nurse, you name it, didn't spend enough time with them, the other point is they can also lodge a complaint to the federal government in regards to that. And just to keep listing the kind of things that complaints could be lodged for, if the patient's culture was not respected, or the patient's language not respected, then it would be possible to turn a complaint in. Now here the government, in my opinion, is overstepping. There's the idea that, well, everyone is in favor of better health care and everybody wants mistakes to be minimized, but the government is basically creating a situation that's outside healthcare issues. The government is trying to enforce a particular, I guess, kind of behavioral pattern that good manners and just common decency should be there to start with. I mean, you'd expect physicians to behave in a nice
professional.
fashion. You would, yeah, and every person you'd be on the street, you'd expect that. But it does create the doctor-patient relationship, which is the fundamental building block, I think, of good health care, is really getting a substantial nip from this, these new regulations that appear to be propagated in the wind, and it's concerning.
Well, what most physicians don't understand is that the measurement process has already begun, and it's taking place actually off the billing records from the hospital.
Yes.
And right now, there's a federal database on our readmission rates and our mortality rates.
Yes, yes.
And they're gathering that information and going to use that to create value-based judgments on physician
Yes,
care there.
yes.
And then this is an additive process to put in there where they're going to put themselves in the role of deciding who's a good physician and who's
Yes,
not a good
yes,
physician.
yes.
And historically, that role has been in the hands of the patients.
Yes,
So
yes.
once again, they're putting themselves in the role of deciding who's the good doctor. Now, doctors are very smart people.
Yes.
Once they figure out a system is in effect, they'll adapt to it to make the system work.
Yes.
Now, that I don't think will be good for patient care.
You know, it makes it. I sort of wonder about. I could imagine circumstances where a patient might demand pain medicine, inappropriate demand for pain medicine, or whatever. Maybe filling out disability forms, whatever the patient.
And you
is.
don't comply with their wishes.
Well, if a patient believes that they have some power over the system by turning a complaint in, it would give them a lot of power to influence a process that should be a neutral one. So, and I don't believe the government or the bureaucrats have thought these issues out. And it appears that with our changing healthcare system, we're about to encounter this kind of thing. And I don't believe people have spoken about it much. It's quite alarming to me.
Well, I appreciate you doing it, and I appreciate you paying attention to it. I'm afraid there's a number of not very well thought out physicians who are going
Yes.
along with this, who don't realize that they're playing into the hands of a large bureaucracy